Welcome back. This week we're going in focus on the nursing shortage in North Carolina. Healthcare and, in particular, nursing issues are a priority for some members of the North Carolina General Assembly as they work to craft policy that can help fix the problem. Some work or have worked as nurses themselves. For more, we welcome on two of those members. State Representative Donna White, a Republican from Johnston County, who is a registered nurse, and State Representative Diamond Stanton Williams, a Democrat from Cabarrus County, who is also a registered nurse. Thank you both so much for joining us. I'm going to have you put your nurse's hat on for me first before we talk the lawmaker side. You've been in nursing. When you look at the numbers that we see today and how big these shortages are, what does that tell you about the field right now?
Well, you want me to speak first?
Yeah.
The numbers are staggering. When you look at, we may be getting 194,000 new nurses, but we're losing 203,000. So when you do that year after year, and you know that even with things that we've tried to do to increase that, it's still, COVID came, and then we have the post-COVID reaction to getting into the field of nursing. So it is very different than when I was in active nursing, and I was an active nurse, full-time nurse when I came to the General Assembly, and still do some private duty. When nurses of my age, and we're not going to talk about my age, but we did have, it's like we were the Florence Nightingale nurses. We had a mission, we went into that mission, and we really didn't worry about what we got paid or what we didn't get paid. We were fulfilling sometimes a dream, a lifelong, mission. And I think that with our younger population and all workforce occupations, it's not just nursing, but we're seeing it across the board that there's not that nurses are not necessarily going into nursing to stay in the same place forever or to stay with the same kind of specialty forever. And that's probably one of the biggest differences that I see in the current workforce and the workforce that I came out of, is that it's just different priorities, different needs. And I think it's across the board. We're seeing it in state employment. We're seeing it across the board. I recently had a press conference, with the Labor Commissioner and Representative Croxter, Secretary Croxter, and it's just, we're seeing it across the board. It's a generational thing. I think that's the new word, isn't it?
We hear that a lot, yes. There's a lot of professions out there that you can say, we know this is a profession we need. Nursing is one of those professions. We know we need it, but is it attractive to people anymore?
Right. Well, I can say this. For the past 20 years, nurses have been the most trusted profession in the United States. I think one of the biggest things that we as a society need to realize is that we have our older nurses, seasoned nurses.
Seasoned. Good word.
Seasoned nurses who have done their time, and it's time for them to retire. We also have those nurses who are professors in the field who need to absolutely be paid well to continue in that field, which makes it difficult for a lot of them to do that. And we know that one of the biggest things that we really want to focus on is increasing the number of students who come into nursing. And to make that attractive, of course, we've done several different things, because yes, you don't have to stay in the same place. You can do different things in nursing, which makes it a good career to be in. But I think most of the times we focus on money versus the passion.
Sure. Yes. That's
exactly
fair. So, the question always then becomes, what can be done from the state level to help with situations like this? Because obviously you're not hiring the private nurses that are out there for the private companies, but what can the state do?
Well, I'm just going to shout it out and say I think that we could pass the SAVE Act.
Yeah.
This has been a bill that I've run for 6.5 years now. It's a safe, accessible, value-directed, effective model of nursing that it lets our APRNs, our Advanced Practice Registered Nurses, function at their full scope of practice, their practice authority, full scope of practice authority, and it doesn't give them any opportunity to do anything that would be outside the parameters of safety for our clients or safety for the institution that they work for. It is an opportunity for them to function at the level that they've been trained at, licensed at by the oldest board of nursing in in the United States. The North Carolina Board of Nursing was founded in 1903. It's the oldest one, and they're the best one as well. But, you know, so these APRNs, Advanced Practice Registered Nurses, they have to go through their education, they have to take their test, and then they have to keep their skill set up to be able to, you know, we all have to keep our continuing education units up and so forth. So, and we have every organization that I can think of related to healthcare, hospitals, nursing homes, you know, private clinics, across the board are asking for the SAVE Act to be passed. And we just have kind of one group that does not want that. For today's segment, I probably won't go any further on that. But I would like to just say that the people of North Carolina are fixing to have at least 700,000, depending on who we talk about or who you talk to and what numbers they're using, because we have passed Medicaid expansion for those who do not have the opportunity to have health care. And we don't have time to go into Medicaid expansion today, but we have done that, and because of that, we're going to be adding another 700 to 900,000 people that can now be able to afford health care. But if we don't have the health care providers there, then Medicaid expansion means nothing.
Well, I can tell you're both very passionate about this, and I'm sure the nursing community is happy to have both of you at the legislature to talk about this. Thank you for joining our conversation. And thank you for joining our conversation as we focus in on the big issues facing North Carolina. We'll see you back here next week for another edition of In Focus. Until then, have a great week.